Suicide prevention officials in South Dakota are reminding residents facing a mental health crisis there are resources available. That's after the state reported some alarming statistics this month. The Department of Health says that in the first quarter of this year, 59 South Dakotans died by suicide. That compares with 28 in the same period last year. It also puts the state on pace to exceed last year's total of 186. Sherry Nelson is Suicide Prevention Director for the state's 211 Helpline Center. She says in 2020, many people were feeling a heightened sense of mental stress caused by the pandemic, prompting them to rally around each other. But she says for some, that feeling might be different this year.
As things are opening up, they get that feeling back again of, I'm going through this alone.
Nationally, health experts noted similar observations about people supporting each other last year, with preliminary CDC data showing a nearly 6% decline in suicides in the U.S. In South Dakota, the Helpline Center provides crisis support 24 hours a day throughout the year. It also offers training in the area of prevention. And while going through a global crisis might create more awareness, Nelson notes that lingering effects still can be felt. She points to past events such as the SARS epidemic or the 2008 financial crisis, where there were increases in suicides among certain demographics.
There was that increase in suicides, but, the main thing is to let people know that there is help available to them, and they do not need to go through this alone.
She says there still has to be conversations that remove any remaining stigma about a person going through a mental health crisis. Prior to the pandemic, South Dakota had the 8th highest suicide rate in the United States. That ranking was from 2019. Mike Moen, Greater Dakota News Service. Find our rate trust indicators to support transparency and accuracy at publicnewsservice.org.